Well, it's too early to tell, but it's a really great sign that the epidemic seems to be slowing down. As you say, the rate of doubling of our cases has slowed down from every 3 days to every 10 days. I'm always cautious because we haven't necessarily seen the peak yet, and sometimes we won't actually know that we've passed the peak until we've actually passed the peak. But my main message was, good job, Canadians. I think all of your work has helped us slow down the epidemic across the country. But much work needs to be done, and we need everybody to maintain all the good work they're doing now in terms of physical distancing or staying at home, washing your hands, and those hygienic measures is helping us slow down this epidemic. But we need to be really cautious right now that we're doubling down to ensure that we get past the peak and slowly let ourselves down on the other side of the curve.
That strong, consistent message that you have delivered every day at your briefing. You raised something because I'm wondering what you're looking for. How will we know when we are at the peak?
Well, as I said, our data can sometimes lag a little bit. So when someone is infected or exposed, they need to go to the doctors, and they may then need to be tested, and then they get reported. So there is a time lag, often of about 2 weeks or so, from that time to when we actually detect the case. And so we are pretty cautious, but we know that many of the measures that we put in place in Canada happened around the middle of March to that week that has just passed, the sort of 15th of March and thereabouts. And we know that all of that good work, the results of which should be observable around about this time. So that's why I'm really keeping a close eye on how the epidemic is evolving. I'm really happy to see that this growth rate has begun to slow down.
So then the question becomes, what happens next? And certainly that is what we're hearing over and over from our viewers. Let me put it to you, Dr. Tam, in the words of Carmen Choi.
In a country as big as in Canada, how are we as a nation go about relaxing the physical distancing measures when the time comes? Since each province and territories have its own numbers, the peaks are different. Will the province and the territories go about doing that at different times on their own? And if so, what are the ramifications of doing that?
So how do we reopen, Dr. Tam, and in particular, put politics aside, what are the public health criteria for lifting the lockdown and reopening things?
Well, in order to move to what we call the sort of new normal, because I don't think that we'll be reverting back to life as we know it before the start of this pandemic wave, because the population immunity is likely still low. We need to actually get a better handle on what that population immunity is. But the first thing and our key focus is really reducing transmission to a very low level. And that means testing, that means contact tracing, and making sure we isolate cases and quarantine the contacts. That must still continue. And with that, we'll be able to also test using some of the new testing that we will be making available, such as antibody tests, to see what level of immunity we actually have in the Canadian population. We will then also be able to adjust those public health measures accordingly. But as I said, that even if we go past the peak, we need to maintain all of those measures, including physical distancing, for quite some time because of the lack of immunity to this completely novel virus in Canada. So, and I think the viewer who's posing the question is right in that we actually have different epidemics going across the country. British Columbia might be different to Ontario, which might be different to the communities in the north, for example. So our tracking, our testing is able to sort of help us continuously track what's happening across different areas of Canada. And so I think potentially the timing of some of these measures might be slightly different depending on where you are. And I don't know if that answers the viewer's question.
I'm sure it does. And you raise the issue of testing. And of course, this is something we'll be returning to in our coverage because the capability of the country has not been where you want it to be, where the country needs it to be, and something that we need to be watchful of in that it is a key criterion for allowing society to return to normal and for things to reopen. Dr. Tam, I thank you for the time tonight.